In today's video, we are going to talk about depression and post-stroke apathy. Now, why am I talking about these things as a physical therapist, where we primarily focus on movement? It's because post-stroke depression and post-stroke apathy are extremely common after a stroke, and they have a significant impact on your recovery potential. So in this video, we're going to go over what post-stroke apathy and what post-stroke depression are, why this matters, and of course, things that you could do or things to be mindful of as you go through your recovery process. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset with the end goal of empowering you with as many tools as possible to take full ownership of your rehab and your overall health. And I will tell you, just personally, in my personal experience, post-stroke apathy and post-stroke depression are the two most critical barriers to progress in physical rehabilitation. And so it matters that you understand these concepts. And because they are so common, there's a lot of you that watch this channel that probably do struggle with one of these two conditions. But before we dive into what apathy is and depression, it is important just to go over a couple of big picture concepts. I'm not going to go in depth into these because I've made whole videos on these concepts, but first is just inflammation. Everyone really needs to understand what is inflammation. Inflammation is basically just your body's immune response to an infection or like a cut on your skin. Anything foreign that gets into the body, the immune system is responsible for getting rid of it so that it doesn't do harm. Most of us know that. Okay, but what's actually going on when that happens? Well, when that pathogen or that foreign object enters the body, it releases some molecules called cytokines. Cytokines are what trigger the immune system to deploy immune cells that will go to the area, get rid of the pathogen or whatever's foreign, clean up the area, and then leave the area, and all is right with the world. It's extremely beneficial. It keeps us alive. But then there's chronic or systemic inflammation. And this is when this immune response, it kind of gets all over the body and it's just kind of going on all the time. There are certain areas of the body that are just constantly releasing those cytokines, which are constantly triggering that immune response. And you can see, based on what the immune response is supposed to do, how this could be problematic, right? You have cells, or you have a system that is responsible for basically destroying tissue. Okay, yes, it's supposed to be foreign tissue, but destroying tissue and getting things that it recognizes or it thinks are like inefficient or not helpful out of the body. So you have this going on all the time, and there is no pathogen, there is no foreign object in the body. Well, then this immune response, basically simplified, just starts attacking like normal healthy tissues. So what are some things that can cause this to happen? Because this does matter when we get further into the video. But those cytokines, those things that are released that actually create this inflammatory or this immune response, are like plaques in the blood vessels can do this. Adipose tissues, adipose cells, which are fat cells, primarily around the organs, can also do this. Chronic elevated blood sugar in the blood can also cause this response. And chronic stress can cause this response. If you think about it, it makes sense. If you're stressed or you think you're under threat, it does make sense that the immune system would be somewhat involved in that type of an emotional reaction, right? So if you have chronic stress, we're not just talking about, oh, I see a bear and I'm trying to get out of the way. We're talking about chronic stress can also cause this systemic inflammation. Systemic inflammation does start attacking almost every system in the body if it's left to persist. Okay, so that's really important. Now let's talk about what happens after a stroke, because those two concepts really do matter when it comes to understanding what is going on in your brain and your body immediately following a stroke. First and foremost, most important thing to understand, which I think people, once they leave the hospital, they kind of forget this, but what caused your stroke? Your stroke was caused because blood flow was stopped, either because of a blood clot or because of a burst blood vessel. Now, it is the cascade of events that follows that initial event that matter for this video. So you get that initial blood flow cut off, and then you get lack of oxygen in the neurons that supplied that area of the brain. That neuron becomes what we call hypoxic, meaning it lacks oxygen. That's a danger signal, right? We need oxygen. Our cells in our brain need oxygen to survive. It deploys or it spits out some of those cytokines, those things to trigger the immune response. You get this hyper response by the immune system because of that initial hypoxic event. So most important initially when you're in the hospital is to restore blood flow so that you can stop that process from continuing. But still, because of that initial insult, you still get this mass deployment or this mass spray of these cytokines that creates an overabundance of these immune cells in the brain. That high concentration of immune cells in the brain, based on just physics, leak out into the rest of the body. They call that like a concentration gradient. Those molecules are just going from an area of higher concentration to an area of lower concentration. That's one potential mechanism. There's multiple events going on during this time. Your body is just trying to get back to homeostasis. Your brain is just trying to get back to homeostasis and doing the best that it can. So this is extremely simplified, but just that immune response is really important. We are going to get into depression and apathy, but it is important to understand that whole process that's going on. So that's within the minutes and hours after your stroke. Then they do think there's like an immunosuppression after that, because you had this overabundance and it poured all these immune cells out into the body. Your bone marrow and your spleen are kind of like storage areas for these immune cells. And they think that those two systems are somewhat involved at some level, that you get this high concentration of immune cells and then the spleen and the bone marrow adapt, which creates some sort of like an immunosuppression. That immunosuppression kind of creates this rebound response where then in the weeks, months, and potentially, based on what some scientists believe, years following that, you get this overabundance of the immune system. So basically you get to that chronic systemic inflammation state that I had mentioned earlier. Okay, so that's all big picture and extremely simplified. Now, let's talk about depression and apathy. So they do think that this neuroinflammation or this cascade of events that occurs after a stroke does play some part in post-stroke depression. Now, why do I tell you that? Because I 1000% believe that rationale or that root cause, we have so much more control over that than our healthcare system leads us to believe. Okay, so there are biological changes that happen because of a stroke that can lead to depression. This systemic inflammation, and this can be tested, they can test like inflammatory markers in your blood, is present after a stroke. And so they think that this is one potential root cause of what causes post-stroke depression. The other one, and the one that's pretty obvious, is just there's certain areas in the brain that are responsible for processing emotions, and those areas of the brain can be damaged. And then also the experience that you're going through, the current circumstances of your life can also cause depression. And then there's also the fact that you're just not socializing as much, and that also is correlated or contributes to depression. So there are some real life events that could be causing that depression, but there are also some biological factors that are going on that could make someone more susceptible to depression. Now, what are the symptoms of depression? Well, persistent sadness. And this is important because we're talking about depression and apathy and distinguishing between the two. But persistent sadness, lack of motivation, difficulty in thinking and concentrating, sleep disturbance, and change in appetite. Now, why does all that matter? Well, if you feel tired, you're not eating, you can't think or concentrate, and you're not motivated, it makes it really, really hard to engage in the activities that facilitate what we call activity-dependent neuroplasticity. So what is activity-dependent neuroplasticity? It's the concept where the brain rewires when you present it with novel activities. If you can't engage in the activities that will create the scenario where the brain has the potential to rewire, it makes it very hard to rewire or get those neuroplastic changes. But now let's talk about apathy, because apathy and depression are not the same thing. Apathy is a reduction in goal-directed behavior. So some of the symptoms or some of the characteristics of someone who is apathetic post-stroke, someone that needs a lot of prompting, demonstrates a lack of concern, blunted emotional response, less interested in events, persists less in activities, meaning stays engaged in activities for less amount of time, and reduced initiative. You can see how that would be problematic if you're trying to get those neuroplastic changes. If you are someone that lacks initiative, lacks overall concern, needs a lot of prompting, and maybe you don't have a lot of social support, that can also impact your ability to engage in the activities necessary to create the necessary brain changes. Now, I will tell you personally, so these are just my opinions on what this looks like, just based on my experience. Someone who's apathetic really just doesn't care. They don't have any goals. This is just my experience. I'll ask someone, like, do you have anything that you want to work on? No, not really. Like, I'm okay with the way that I am. Now, there's another important concept to talk about, and that's anosognosia. I think that's how you pronounce that. But this is a condition where someone literally does not think there's anything wrong. So they don't think they have any weakness. They don't think that there's anything wrong with their arm or their leg despite not being able to move it. That is also a symptom of some strokes, in my experience, more so with people that have a stroke on the right side of the brain. But when I look at the data, it seems like they're not, there's no consistency on that, right versus left. So again, that's just my experience. 9 times out of 10, that's someone that's usually had a stroke on the right side of the brain. And so it's kind of hard. Is this person apathetic, or do they really just not think that there's anything wrong? And I think maybe a neuropsychologist could figure that out, but that's definitely above my pay grade. But so what I'm describing to you is what that looks like, but it could also be this idea that someone doesn't know what's going on. But it is really like, you know, is there any problems with your walking that you want to work on? No. You know, do you have trouble with anything? You know, like, I will prompt and try and ask questions, because usually they're there because a caregiver brought them, but it's not ideal for a caregiver to have a goal if the patient does not also have the goal. So that's why I go into these a little bit longer discussions and these kind of back and forth to try and get to some kind of a goal. And so that's what that looks like, is the person just really just doesn't have any goals. You know, they can oftentimes like say things that, I mean, are potentially hurtful to their caregivers. Again, these are just my observations, and they really just don't see anything. There's no problem with that. So lack of concern. Again, these are just my experiences, just what I've seen. And they're really just, they don't really like kind of going out or engaging, because I'll even ask, like, you know, do you want to go to a movie, or do you want to be able to do something? And it's like, no, I'm just kind of I'm okay, just sitting at home, right? And so you could see also how this could get confused with depression, but it is important to note these are two different things. The main difference between the two, based on what my understanding is of a couple of the articles I read, which I will link in the description below, is just that they're the energy level and the overall mood. Like someone that's apathetic doesn't necessarily have like a really depressed mood. They're just kind of indifferent. Whereas someone who has depression, that fatigue is really evident and their mood is depressed. And you can kind of see that in their language, or at least I can, in their language and kind of how they talk about their circumstances and things like that. So that would be the main difference. Now, what causes apathy, or how does a stroke cause apathy? Well, based on just a couple of articles that I read, one is that the areas of the brain that actually process emotions are damaged. But one interesting thing that I found about apathy is they have noticed that, different from depression, it does consistently get worse over time. And the explanation for that goes all the way back to the inflammation and neuroinflammation that I talked about earlier. Remember, a stroke is a vascular event. There are vascular blood flow changes after a stroke. Other explanation for why people become more apathetic over time is that hemisphere, that entire hemisphere of the brain is starting to atrophy because of this continuous systemic chronic inflammation. Now, why does all of that matter in understanding the difference between these two things? Because the treatment is very different. So for depression, some things that have been found to work are certain antidepressants. Now, I'm not a doctor, but something I worry about with antidepressants is the gut microbiome and the gut-brain axis, and there's other things that I worry about that, but I do think that there are some people that absolutely need an antidepressant. And again, not a medical doctor, but other things that have been shown to be effective are therapy, counseling. I know that generationally, some generations are really opposed to this, but it's absolutely essential, especially for learning how to cope or adapt with your new situation. Not bad necessarily, but your new situation in which you are presented with. For someone who's struggling with depression, getting out, getting around people, socializing, absolutely important. And sometimes it'll take the caregivers to help with this. When someone's depressed, they really don't want to leave the house. But once you get out and you get around people, if this is depression, we'll get into apathy here in a minute, but if this is depression, that really does help someone who is struggling with depression to just get around people, socialize. This is just my opinion, not found in the two articles I read, but also having purpose, finding something that gets you out of bed in the morning that motivates you. And once you start helping someone, I don't know anyone that's ever helped anyone and didn't get something in return, as far as like a mood lift or an emotional lift. So finding purpose or finding something that you can do for someone else, even if that is just you, if you're a caregiver giving jobs or responsibilities and showing your appreciation at home that your loved one is doing that thing, whether it's, unloading the dishwasher, folding the laundry, something. And then physical activity. And this one, the ball gets dropped on this so much because people think they can't do anything. You can propel your wheelchair around. You can go outside, get sunshine, get fresh air, all proven to boost mood, and just propel your wheelchair around the neighborhood. If you have a pool in your area, most public pools have a lift. Just put a life jacket on, get in the pool, even if you're not kicking both legs, and just move. It's a weightless feeling. You'll feel great. Lots of my patients use it. I don't think, and I've done videos on this, I don't think it's good in normalizing your walking, but as far as physical activity, absolutely essential. And of course, the main reason I talked about all that inflammation and everything, what causes chronic inflammation, is because your diet matters. The foods you are putting into your body can either promote less inflammation or it can promote more inflammation. Now, I don't think anyone should do anything drastic. If you're already sad and you're depressed and you think that food is helping you, I don't necessarily agree with that, but I get that comment a lot. There's nothing else I can do but eat. It is not going to be easy, but if you eliminate, and I get this question too, what should I eat? If you eliminate ultra-processed foods, if you only did that and sugar, I don't think you need to read any books. I don't think you need to go beyond that. If you are someone that is eating ultra-processed foods and you are consuming a lot of sugar, it is absolutely contributing to your symptoms. Not a doubt in my mind. So if you want to pull the greatest lever for both your physical recovery, but also your emotional well-being, it is to eliminate sugar. If you wanted to go one step further, I would say eliminate grains. But at the very foundation, top level, is get packaged foods out of your diet. So ultra-processed foods, anything in a package, anything that has a shelf life. Most foods on the inside of a grocery store that don't need to be refrigerated, with the exception of like dried beans, are ultra processed. Vegan meats are ultra processed. Lunch meat is ultra processed. I would get rid of all that. If you really want to feel better, you will feel better. It'll just take time. Pull the Band-Aid off. Get some of those foods out of your diet and give it at least a month. And I promise you, it will have some impact on how you feel. But now let's just talk about apathy and what is the treatment for apathy. Well, they know that cognitive behavioral therapy has some effect. So what cognitive behavioral therapy is just where a therapist helps you to optimize your thoughts and your feelings that will drive optimal behaviors or lead to optimal behaviors. So what types of CBT do they focus on? Things that will allow you to get more enjoyment out of your physical activities or cognitive activities, but get more enjoyment out of those. And CBT has been shown to help with that somewhat. Neuropsychologists can also help to develop behavioral strategies that can be optimized for your recovery, meaning that you can engage in the activities that you need to do to get those neuroplastic changes. They can help with goal setting, self-monitoring, help you establish goals, help you develop problem-solving skills. So can be beneficial. Now, I will say in my experience, a lot of neuropsychologists just like to diagnose you and they don't really like to treat. But sometimes just having that session with a neuropsychologist and having the awareness of what is actually going on, why do you not want to engage in activities, is super beneficial to just kind of see it on paper. They will do tests with you. And I know for me, even like having actual numbers to something and seeing kind of where I'm at with something, if it's bad, it does motivate me to want to correct said thing. So I do think it's valuable for that, even if they kind of refer you to someone else to actually do the treatment. RTMS has also been used for people after a stroke with apathy, and in some small studies, they've shown progress. And what RTMS is repetitive transcranial magnetic stimulation, basically like E-stim for the brain, non-invasive, just putting electrodes on the outside of the brain. And that E-stim can either excite a brain area or inhibit a brain area. And in some small studies, it has been shown to be beneficial in improving someone's goal-directed behavior post-stroke. And then again, of course, I'm going to mention lifestyle in general. Proper nutrition, adequate good quality sleep, exercise can prevent that secondary generalized brain atrophy that you are at risk for after a stroke. Especially when I look at some of the data as how apathy gets worse and why they do think it is correlated with this kind of just overall brain atrophy. You want to prevent that as much as possible. So optimizing sleep, 7 to 9 hours of good quality sleep, going to bed if you can between 10 and 11 at the latest. If you're on a CPAP, use it. I know tons of people that don't use them. Get activity, get outside, get sunlight, get your vitamin D, touch some grass, and your nutrition. Eliminate ultra-processed foods. But that is it for this video. I hope you guys found this video helpful. I hope that some of you, or if you're caregivers that are struggling with either depression or apathy, you will comment in the comments to just talk about your situation, your experiences. Have you tried things that have worked either for yourself or for a caregiver or for a loved one to motivate them to do their exercises? Leave those in the comments below. Oh yeah, and one more thing. I think one of the main reasons I made this video is also for caregivers. Sometimes you are just fighting an uphill battle. So just know that there's these underlying syndromes or conditions that are going on in your family member, and just to be patient, know that they don't not love you, and they're not trying to be mean, or they're not trying to hurt your feelings, and they really are doing the best they can based on what their brain state is. And when you can kind of zoom out in some of those more challenging situations and just recognize that this is not personal towards you, there's literally something going on in their brain that's causing that. I hope that will help you again when you're in some of those more challenging situations. But that is it for this video. Hope you guys found this video helpful. I enjoyed spending time with you all today. I'll see you in the next video. Have a good day.